I was in pain. Annually, I would show up in the sonogram office begging for one more sonogram to figure out what was causing all the pain.
Ruth came to me, she's been a long-time patient, and over the years has had some increasing problems with heavy bleeding and increasing problems with pelvic pain, and it was beginning to get in the way of her daily activities. We initially tried treating her heavy bleeding with other minimally invasive options like endometrial ablation, and this controlled her symptoms for a few years. But over time, she began to have bleeding again, and she began to have pelvic pain and discomfort.
It left us feeling both a little just out of sorts and wondering what can we do to get back to the free, carefree, happy lifestyle we enjoyed.
When it got to the place that I was starting to come in pretty regularly, Dr. Hartley said, "That's it. You've suffered enough. I'm ready for us to get this over with."
We didn't want her to spend a lot of time out of work. We didn't want her to miss time with her family, so we decided to do a robotic assisted hysterectomy. We call it robotic surgery. The robot doesn't operate for us, but the robot increases our range of motion, allows us to use instrumentation that we didn't have available to us previously, and allows us to operate in smaller areas.
The day of the surgery, my husband drove me and Dr. Hartley came to see me. The anesthesiologist was there. And going in, it seemed like the simplest procedure. And when I felt better, I was up and I was around, and I was amazed that chronic pain that had kept me under the weather for years at a time was over.
Life's been great. Ruth and I still enjoy being very active, and we've got our lives back. It has truly been a blessing.
Within 2 weeks, Ruth was feeling great, and within 4 weeks, she was back to work.
Dr. Cindy Hartley has changed my life, and now I'm a new woman.